Hello, Teresa. I'm Robin. It's nice to meet you.
Nice to meet you.
So today I think you were interested in some Botox. Is that correct?
Yes.
What areas are a concern of yours?
The crow's feet bother me a little bit, right between the eyes and some in the forehead.
Okay. We can definitely address those with Botox, okay? Have you ever had Botox before?
I have not.
Alrighty, so I'm gonna give you some information about what Botox does for you and what you should expect from it, okay? What's most important is that Botox starts to kick in about three, maybe sometimes 2 or 3 days. It can take up to 2 weeks to get final results. So I always let my patients know in 2 weeks, if you feel like you're moving as strong as you were previously, then you should come back in, okay? So what Botox does is it paralyzes the muscle, so you can't make the facial expression that's leading to those lines that you're seeing in those areas, okay? So those lines may not disappear with your first Botox, okay? But you won't be able to raise your eyebrows as strong that's leading to that line on your forehead there, okay? So with time, your body will adjust and hopefully build collagen into that area, and then that line will fade, okay? Some people that fades at 2 weeks, okay? Other people, they need a couple of Botoxes under their belts to be able to get that line to fade away, okay? It does last about 3 to 4 months, so it is not permanent. So you come about every 3 to 4 months, and if you want to maintain those results, we do tell patients to come in every 3 months. When you have deeper lines like the one on your forehead, you definitely should keep up with it every 3 months, okay? As far as injecting, after I inject today, you may look like you have little welts for about 10-20 minutes, then they'll be gone. Some people that doesn't happen to, but some people it does. So I like people to be aware of that, okay? You can wear makeup immediately if you would like. We also tell patients no lying down for 4 hours, no wearing a hat or rubbing the area for 4 hours, okay? The reason for that is I don't want the Botox to move into a muscle that I didn't intend it into, because then problems can occur, okay? Also, there's always a possibility of bruising. It's uncommon, but it can happen. So I like people to be aware of that as well, okay? Do you have any questions before we get started?
No, I think I'm ready.
Okay, well, I'm gonna go ahead and draw up your Botox, and then I'll be back to show you how we're gonna go ahead and inject,
Thank
okay?
you. Thank you.
Hello, Teresa. So now that I got everything prepared, the first thing I'm gonna do is wipe you down with a little bit of alcohol, okay? So I'm gonna wipe all the areas we're gonna do. We're gonna do between the eyes, that's called the glabella area. That's a fancy medical term for it. There's gonna be 5 injections that we do in that area because there's multiple muscles in that area, okay? We're also gonna do your forehead here. And I'm gonna come right across your forehead. It's gonna be a couple injections in there as well, okay? And then we're gonna do right around the eyes. Typically we do 3 to 4 injections around each eye, okay? Any questions about that?
No.
Alrighty, so what we'll do is we'll get started. You're gonna feel me pinch the area, and then I tell patients another little sort of pinch or a little prick, okay? It is very fluid-like, so almost like water, so you won't feel a lot of pressure or anything like that, okay? So everybody says it's real tolerable. Most people are like, oh, you're done, and they don't even realize I've done anything, okay? Alrighty, so what I'm gonna do first is I'm gonna pinch the little skin right here in the center, okay? And then you're gonna feel another little tiny pinch, okay? Here we go. Is it? Not too bad?
Not at all.
Good. Okay, I'm gonna have you squeeze that muscle really strong there so I can see where your muscles are. Perfect. And then relax. Okay. Another little pinch. Alrighty. And then squeeze again for me. Perfect. And then relax. Pressure there. Okay, squeeze again and relax. So this one to the outside there can give you a little bit of a lift, okay?
Oh, great.
And then we're going to do the other side. Okay, and squeeze and relax. Last one. Perfect. You only had one that had a little bit of bleeding, so that's awesome.
That was easy.
Next, we're going to do your forehead, okay? Now, these are a little different, okay? You're going to feel me sort of tug at the skin, okay? Go ahead and raise your eyebrows and then relax. A little pinch. And then raise, relax. So how I'm having you do the facial movements, sometimes doing those after treatment can also help the Botox go into that muscle better. So by contracting the muscle, it pulls the Botox into the muscle that you're trying to prevent from contracting. Okay, so don't feel like you can't move today. I want you moving today, okay?
Okay.
Go ahead and raise your eyebrows again, and then relax. And then one last time. Perfect. Not too bad?
Not at all. Very easy.
Good job. Okay. I'm going to have you tilt your head this way a little bit, and then that way I can see your crow's feet. Just like I had you do with the other areas, I'm going to have you smile real big for me so I can see where those are. Perfect. And then go ahead and relax. You're going to feel a tiny little pinch again. And then one more time, smile and relax. And then last time. Okay. Perfect. Awesome. Okay, I'm gonna have you tilt your head towards me. Yep, perfect. Go ahead and smile again. Last time. Perfect. Alrighty. So, just like what I had explained in the beginning, just as a reminder, no lying down, rubbing the area, or wearing a hat for 4 hours. Okay. Otherwise, there's no restrictions, okay?
Great.
And then 24 to 48 hours, you may start to see it work, okay? And then at 2 weeks is the final results, okay? And then we'll see you back in about 3 to 4 months,
Great.
okay?
Thank you very much.
You're welcome. Any questions?
No.
Alrighty. Well, you have a wonderful day,
Thank you,
okay?
you too. Thank you very much.
You're welcome.